It's about 110,000 people in the UK living with HIV, but 4,700 in England, 5,200 UK-wide, are living with HIV and don't know it. They haven't been diagnosed yet, and they need a HIV test. And that's why Testing Week is happening this week.
And HIV testing, I mean, it was really interesting reading into this, is actually relatively simple, or certainly a lot simpler than people might expect.
So quick and easy. You can do a simple finger prick test and get a result in 15 minutes. You can do an oral swab and get a result in 20 minutes. And if you go to a sexual health clinic, they'll give you a result pretty damn quick.
And it's really interesting to hear the numbers of people that you say are in total living with the disease across the UK. And what is their life like? I mean, is it manageable now, that the advances in the last decade or two?
Living with HIV is so much different to how lots of people might assume or would have thought if they last checked in on this story in the 90s or the 80s. People living with HIV today get moved on to treatment almost straight away on their diagnosis. That means that within weeks of being diagnosed, the virus is no longer attacking your immune system. And if you have sex or have a baby, you cannot pass on the virus. So it is a world away from where it was, and people will have a normal life expectancy. In fact, some people think it'd be longer because you see a doctor so often.
And I guess when I'm so interested in this, when did the massive step forward, the massive advance sort of happen? When did it change that?
We've had a couple through the years. So at the late 80s, a test became available. In the late 90s, treatment became effective. And then in 2018, the science was categoric that if you're taking your medication, you cannot pass on the virus. And they did a survey, 2 million acts of condomless sex, and not one transfer for a partner living with HIV taking the medication to one that wasn't.
And in terms of the testing, I mean, it clearly, as you've explained, it's so easy to do, and yet there are these 5,000 or so people living with it without having had the test. Have we always been a little bit behind on the testing? Was testing better? Has it dipped? Just talk me through the sort of factors there.
The testing technology is at absolute best at the moment, and it's available in more places than possible. So you can go to any sexual health clinic across the country. This week, it's free for anyone across the UK to get a HIV test. In England, that's normally a rarity. Scotland and Wales, the tests are always on, but in England, it's just this week. But we've now got the Prime Minister committing £27 million from last World AIDS Day so that 90 A&Es will automatically test people if you turn up in A&E. And that's starting to find huge numbers of people.
And the Prime Minister had a test himself?
He's done a test himself in his house. We were there with him as he had a test with Beverly Knight, one of our patrons, and he showed how easy it is to do and how simple it is. And it arrives in your home in a confidential envelope. It's free all this week if you book them today. And he did that test and showed what that meant and became the first global leader to have a HIV test.
And presumably, I mean, I might be wrong on this, but presumably the message isn't to tell everyone across the country to go and have a test, or is it? I mean, what might those 5,000 or so people be experiencing that would be a factor that you'd suggest means go and have a test?
It's always best to know your status. Lots of people, when they acquire HIV, don't really have any symptoms at all. It wouldn't be until it was undiagnosed for many years that they might present. So if you've had sex without a condom or the condom has failed at some point, it might be a good idea to have a HIV test and to make sure you know your status.